Adamantinomatous Craniopharyngioma containing teeth. My name is Danilo Campo. Definition. Historically, Adamantinomatous Craniopharyngioma closely resembles some odontogenic tumors and cystic. In the years since he underwent surgeries, the patient has recurrent shunting for bilateral subdural hydromas and received thyroid and adrenal hormone replacement therapy.
This is a 16-year-old male with bitemporal hemianopsia and chronic headaches. There is a circumscribed T1 hypointense, T2 hyperintense mass centered within the sellar and suprasellar regions. The lesion demonstrates T2 flare hyperintense signal, facilitated diffusion, and a thin peripheral rim of post-contrast enhancement. There are lobular cystic components which extend into the enlarged sella turcica. The mass enlarges the suprasellar cistern with elevation and effacement of the floor of the third ventricle. The lesion extends posteriorly to the level of the interpedunculaire cistern, which is slightly splayed. There is contact with an elevation of the optic chiasm and prechiasmatic segments of the optic nerves. There is also contact and partial encasement of the supraclinoid segments of the right and left internal carotid arteries. This is a case of an adamantinomatous craniopharyngioma. Craniopharyngiomas occur with a bimodal distribution. The first peak occurs between 10 to 14 years of age, while the second occurs in middle-aged adults. Pediatric cases are most commonly composed of the adamantinomatous subtype, while the papillary subtype comprises the majority of cases in middle-aged adults. Cases occur in males and females about equally. Symptoms include headaches, visual abnormalities, hormonal imbalances, and behavioral changes. Adamantinomatous craniopharyngiomas typically demonstrate a lobular contour due to the presence of multiple cystic components. The differential includes Rathke cleft cyst, cystic pituitary adenoma, epidermoid, and intracranial teratoma.
Applications in medicine. 4-month term male infant presents with increasing head circumference on routine pediatric visits. MRI of brain revealed heteronomous change in suprasellar mass. Multiple structures along the right periphery of mass showed characteristics similar to those of tips in the mandible. The patient underwent tumor resection through a right peritoneal approach. Craniopharyngioma is a brain derivative of pituitary gland embryonic.
If a young child presents with slow growth, possible visual defects, and a suprasellar lesion that is solid, cystic, and calcified, what would you expect is the cause? Craniopharyngiomas are tumors which arise from remnants of Rathke's pouch in the anterior pituitary. If a young child presents
Pros and cons. He's making good developmental progress and as a part of his follow-up, he currently undergoes off-routine MRI. The surgery has consequences. In the years since underwent surgery, the patient has recurrent shunting for subdural hydromas and received thyroid and adrenal hormone replacement therapy.
It's called a teratoma, and it's literally the most terrifying thing that I've ever heard about in my life. Hello, hello everyone. Lacey Green here for D News. When you think of places where you might find teeth growing, I bet your brain doesn't come to mind, but that's exactly what happened last week in Maryland in the body of a 4-month-old infant. The baby had a brain tumor, and when doctors went to remove it, they found several fully formed teeth in there, similar to the teeth normally found in the lower jaw. The baby's now in recovery, but it is definitely a WTF moment, and it's kind of making my whole week. Nature is such a beautiful freak. Why or how on earth were there teeth growing in his brain? While the exact causes are unknown, scientists have hypothesized that the reason teeth might grow in a tumor is because the tumors themselves develop from the same cells that create teeth. This case is a particularly strange occurrence because teeth have never been found in a craniopharyngioma, which is the rare brain tumor the infant had. However, this isn't the first time doctors have found teeth growing in strange places. Take the bizarre case of Miguel Belkin, who had always had breathing troubles growing up that were blamed on his heavy weight. When he was 18, he began coughing up blood, leading scientists to find a basketball-sized tumor in his chest, which was growing not only teeth, but hair and what may have been the beginnings of fetal eyes. He lost nearly 30 pounds from the surgery and is now doing a-okay. Another 23-year-old woman in India was born with an abnormal left eye, which continued to swell throughout her youth. Finally, desperate and losing her vision, she went to the doctors and found out that she had a tumor in her eye, which had grown 2 fully formed teeth. While it's extremely rare, she wasn't the first to have teeth growing in her eye. There have been 70 cases documented since 1850. The types of tumor in question with these cases were teratoma tumors, which, unlike a craniopharyngioma, contain all 3 types of tissue that are found in human embryos. They're an aggressive but usually benign type of tumor that can pop up all over the body, like the brain, lungs, or liver. But what about the vagina? Yes, I'm referring to so-called vagina dentata. Is there some truth in there? This 21st century folklore has endured all the way from ancient Greek mythology. The story goes that women's bodies have secret abilities that are quite dangerous, and having sex with her could result in male castration. Now, if there's ever a story that summed up the enduring fear of female sexuality throughout history, this is the one. Although, teeth have been found growing
Issue became in Ecuador. Historically, Adamantinomatous craniopharyngioma closely resembles some odontogenic tumors and cysts. Adamantinomatous craniopharyngioma was identified, which is a slow-growing tumor arising from ragged pouch, an embryonic precursor to the anterior pituitary. Such tumor consists in organized stratified squamous epithelium.
This is a 12-year-old male with chronic headaches and new-onset diabetes insipidus. Arising from the anterior surface of the infundibulum, there is a circumscribed centrally cystic lesion. On the sagittal T1 weighted images, the central cystic component demonstrates signal intensity slightly greater than the surrounding CSF space. On the FLAIR weighted image, there is hyperintense signal within the central cystic component compatible with a combination of hemorrhage and proteinaceous fluid. The high-resolution fluid-sensitive sequences demonstrate a lesion with a thin margin abutting the posterior and inferior aspect of the optic chiasm, with slight anterior and superior displacement and deformity. The post-contrast T1 weighted images demonstrate a thin enhancing margin of the infundibular lesion. The general differential includes adamantinomatous craniopharyngioma, Rathke's cleft cyst, and infundibular cyst. On further evaluation with CT, there were a few faint calcifications within the lesion wall. On resection, this was found to be a cystic craniopharyngioma. Craniopharyngioma are thought to arise via 2 mechanisms. The first as remnants of the craniopharyngeal duct, while the second is from squamous epithelial cells of the pars tubularis of the adenohypophysis. 75% of the adamantinomatous subtype tend to be in the suprasellar compartment, with the possibility of extension into the surrounding cranial fossa.
Conclusion: the tumor veins in the pituitary gland can cause secondary health problems. The immune system, thyroid levels, growth hormone levels, and testosterone levels can be compromised from the craniopharyngioma. All of before mentioned health problems can be treated with a modern medicine. The treatment generally consists in subdural transpenial excision surgery using the transpenial route, often performed by a joint team of ENT and neurosurgeons.
So unfortunately, in this case, it's hard to, so we need to call it non-diagnostic in terms of the specimen. So basically what we got here, it's a normal anterior pituitary gland here and some area in the, in the lower part, which is at higher, okay, so this is a normal pituitary. You will see some hemosiderin-laden macrophages here and, normal looking anterior pituitary cells. And the inferior part, basically we see some fibrosis and we see some, small mature lymphocytes, some eosinophils, and some plasma cells. And the same thing here, you see some hemosiderin-laden macrophages here, just some chronic inflammatory cells, and some, crushed or cautery artifact, but we don't see any definite cyst lining or anything that look like cranial.
Thank you.